The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host and producer, Kristina Lou, along with my co-hosts Otto, Los, and Paula Ewell. Paul and I work together at the Town of North Hempstead Services for the Aging, Project Independence, where I'm the Director of Senior Citizen Affairs, and Paula is the Deputy Commissioner, and Otto is volunteer, supporter, friend, award winner, I should say now, because we just celebrate our 20 years of Project Independence, which we'll get into later. But Otto won an award, so now you're an award winner. I could add to your intro.
I'll put it up on the case with my other one.
with your Oscars.
That I got when I was 17 playing baseball.
See? I knew another one would come around, so there you are. But today we're talking about something very, very important that comes up quite often, and it is the category of Medicaid. Medicaid, certainly, I've been doing the show for a long time. It still can be very confusing. There's a lot of misinformation that could lead to costly mistakes for seniors and their families. Many people believe they must spend all their assets or give away their home or really just wait till the crisis occurs, but that's not always the case. And joining us today is friend of the show, Ron Fatoullah of Meltzer, Lippe, Goldstein, and Breitstone, who will discuss the complexities of Medicaid planning, long-term care, and whatever comes our way. Ron's always great. You know, he just rolls with the random questions that we might ask him. But let's break down all these Medicaid misconceptions and just how to plan for your future. So welcome, Ron.
Thanks so much, Kristina. Otto and Paula, thank you. It's great to be here again.
Yes, we're so glad. I know. You know, I meant to look before the show about how many times you've been on, because you've given us such wonderful information over the years. And this is something, you know, that comes up a lot. You hear, you know, and it's always the crisis. You know, I've been doing social work for a while now, and that's always something that kind of comes up. Is, oh, now I need, you know, Medicaid to help pay for things, and how do you do all this? So let's go through, break down all these myths. So let's start. You sent over some great information, so I will start with the fabulous questions that you have.
Wherever you start is good for me.
So there's currently no look back for Medicaid home care.
Correct.
What does that mean?
Sure. By the way, there is a 2.5-year look back on the books, and that law was passed in New York about 6 years ago.
Okay.
Never implemented. Wow. There's been legislation trying to overturn it. It doesn't look like it's going anywhere, but who knows? Okay. One day we might wake up, and we might have a 2.5-year look back for Medicaid home care. But right now there is no look back for Medicaid home care. That means that when you apply for Medicaid in general, you can only have in New York State $33,000 in assets. I'm going to be rounding off numbers a little bit. It's $33,038, but we'll stick to $33,000. So you can only have $33,000 in assets. If the applicant has more, they're over-resourced and not eligible. That's for beginners.
Yep, I hear Otto itching.
I'm just thinking Medicaid, the top-level look at Medicaid, all right? People have visions of part of that is SNAP, then there's home care, then there's nursing home. How about let's just, like when you say Medicaid,
break it down.
Different kinds.
What kinds of basic kinds of long-term care?
I mean, when you apply for Medicaid, are you applying for Medicaid, period? Covers everything?
So there are so many myths and people are confused. There is Magi Medicaid. That's the health insurance. It's Obamacare, and it's not what I'm talking about, actually. It's for individuals with low income, and you can apply, go on the marketplace, and get health insurance. And that's Obamacare, Magi Medicaid, based on your modified adjusted gross income.
So that has nothing to do with what we're talking about.
Nothing to do with what we're talking about.
But I think that's a common myth. I think that's right. Everyone gets it wrong.
Yeah, I mean, I think a lot of people don't know that.
Yeah.
That's right.
You know.
Yeah.
I didn't.
Yeah, that's probably the number one.
Right. There you go.
I mean, I had an idea.
Well, now, good. So I'm very happy that I'm here. So Magi Medicaid is only health insurance through the marketplace And it's based on your modified adjusted gross income.
So that's like SNAP has not like food.
That's different.
That's another.
No, that's totally different. Those are
not
other
part
benefits.
of Medicaid or just a separate.
I'm not sure if it's part of Medicaid or not, but it's a separate benefit
Yeah.
Right.
than what I'm
It's a
talking
separate
about.
entitlement.
Totally separate.
Okay.
But it's wonderful. Yeah. So,
Okay.
so that's Magi Medicaid. So many people confuse that with what I talk about day in and day out is long-term care Medicaid, whether at home, in a nursing home, or even in an assisted living. Most people don't know that there are Medicaid funded assisted living programs.
Not many though, right? I mean, like
There
is it
aren't
the more-
many, but
Yeah.
there's
It's
a lot
good to
out
know.
there.
Okay,
yeah,
that's good to
yeah,
know.
Yeah. And why don't we start with that, Paula,
Now,
since
does
you
this
mentioned it?
all go under one term? Like, there's in-home care, in the
Home
nursing
care,
home. Type.
right.
Is this all under one umbrella? Like, you
Yeah.
apply for Medicaid,
Well,
long-term care, that's a,
We call it non-Magi Medicaid,
Right,
actually.
okay.
So it's not based on your modified adjusted gross income. It's based on the assets you have,
right.
and also they look at your income. But New York State is a spend-down state, and basically the government wants you to spend down your money until you reach the Medicaid level of $33,000. Plus, there are a couple of exceptions. One, which law I changed.
Right.
But you get down to $33,000. That's what the government wants you to do. It's not what I want you to
Right,
do.
right.
I want you, every listener out there, to know that you likely can go on Medicaid if you need it. We just had a client who has $20 million and asking me about Medicaid. That is not appropriate. But no, I know you're laughing, but I get that call a lot.
Right.
So we were doing estate planning for this couple, but definitely not appropriate. But Medicaid is there for the middle class, and that there's a misconception that you have to be poor to go on Medicaid. You sort of do, but there's ways to get it done so that you could live your life fully and go on Medicaid and not become impoverished. And that is actually why I
That's the
went
big
into
myth.
elder law to
That's the big
begin
myth.
with.
That's like the
Myth.
number one myth.
That's it.
Because I saw, it started out in the 80s. I saw a woman who came to me, she had $700,000, and she said, we blew through all of my, our money. We now have enough for 1 month in the nursing home, and we don't know what to do. And I went berserk in my mind. And I said, I really do wish you would have called me sooner,
Right.
because I hate to see you live out the rest of your life with no money,
Right,
but there would have been a way to save your assets. And it started from there, where my mission was, I wanted to get the word out. It's part of my mission, my being, to get word out so people know that they do have options, long-term care options, where they don't have to become totally impoverished.
What, we talked briefly offline, but most of the people I know who are in the older category know that they should have a will, they know they should have health care proxy, they should have a power of attorney. And then it comes down to your house, and should you have a trust, shouldn't you have a trust, your assets, all of that goes around that whole world is complicated to most people, including myself, because there are so many variations, as I see it, going down the line. How about, like most people say, well, I make too much money, I have too much money, I have this, I have that. What are the factors, the criteria that determine whether you even should think about it? Like between cash assets or
when is somebody appropriate
resources,
for Medicaid? Yeah. Well, that's where the misconception comes in, I think. Yes, the Medicaid asset level of non-retirement assets is $33,000. Let's break it down a little bit. So of non-retirement assets, $33,000.
That's cash, CDs,
stocks, bonds. Right. Not a lot of money.
Right.
But let's break it down a little bit.
Right.
I changed the law with a case in Queens about 20 years ago where I challenged New York City Medicaid saying that retirement accounts should be exempt because we're SSI-related Medicaid state, but we weren't following the SSI rules. So New York City, without going to a fair hearings, after seeing our argument, seeing it on paper, we drafted briefs back and forth. New York City eventually said, yes, retirement accounts in payout status are exempt from Medicaid. So if a client comes into me with $750,000 in retirement accounts and, $500,000 in other assets, we will definitely try to get them on Medicaid. Not try, will.
Yeah. Now with that, you get a distribution. Let's say with the $750,000, somebody takes a distribution of $35,000 a year or whatever. Is that counted as income?
Sure. Let's say it's $36,000.
Right.
So
$3,000 a month.
$3,000 a month. I could do that math. I don't know about the $35,000 so quickly, but anyway, $3,000 a month of income because Medicaid breaks it down on a monthly basis. Yes, they will count the income that you take, but you only have to take the required minimum distributions. Now, you might think, well, of course, you always only had to take your minimum required distributions. Not so. The law just changed where Medicaid just a few months ago said you don't have to maximize benefits. Nassau County and Suffolk County, I know we're in Nassau, Nassau County forced Medicaid applicants who had IRAs to use a Medicaid chart, saying they have to get more income every month and take more out of their retirement accounts for the retirement account to be exempt. No more. The law changed a few months ago where Medicaid said you don't have to maximize many different items. I would like to, maybe later on in the show talk about it. It's a very big deal. But they say you don't have to maximize your retirement, when you're past age 73, and you have to take your required minimum distributions. You don't have to use the Medicaid life expectancy chart. You could just use the IRS chart. You don't have to maximize. So Nassau County, on the spot, changed it. So when you're 73 or older, you have to start to take your required minimum distribution, your RMDs, but you don't have to take any more, even if you're on Medicaid. And what about all of my clients? And I hate these clients because I hate seeing all of these clients with early onset dementia. It really affects me. I just wish this disease went away. But we have so many clients with early onset. Earlier, they're younger than age 73. They have retirement accounts. So this new law says that you don't have to maximize your benefits. And so the way this is interpreted is that you don't have to take your required minimum distributions. You could take $100 a month from your retirement account because you have to put it into payout status. That was a requirement when I argued my case years ago. So yes, it has to be in payout status, but payout status could be $100 a month.
Okay, so let me just...
You could have $1 million IRA in your early onset dementia and you need a nursing home, but you could take $100 a month from your retirement account until you reach age 73 when they make you take your required minimum distributions.
Well, let's say you are over 73 and you do have to, which I just made.
So it just slid right in there.
You have to take the required minimum distribution. So this example of $750,000, the required minimum distribution could be like $36,000.
Well, it could, but you take the value of the retirement account as of December 31 of the prior year. And at age 73, I just know it because so many people ask me, you take the value of that retirement account, let's say $750,000, divide that by 26.5. You'll come up with a number divided by 12, because Medicaid looks at everything on a monthly basis,
Right.
and that would be the amount of income that Medicaid says you have that month.
Yeah, and you can't do anything about that number. That number is,
That's your income, but there's a lot that you can do about it if you're getting home care.
yeah.
Yeah.
But then you have other, like, okay, what we're talking about right now then I guess is what your income is.
Well, sure.
Like people have
Sure.
a pension,
Right.
which I
I
don't
hope they do.
think you can do anything about. It's income.
There's nothing you can do about
Social
it. Pension and
Security.
Social Security. ERISA laws say that you can't alienate your Social Security or pension. In other words, and this is the reason, if there's a creditor that comes knocking on your door, not you, Otto,
Right.
someone else.
Yeah, right. Well,
but
I just went through ID theft, so
Oh, did
I'm
you?
going to have
Oh,
somebody
my
knocking on my
God.
Well, hold that thought, guys, because we need to take a break. So after the break, we will continue talking with Ron Fatoullah of Meltzer, Lippe, Goldstein, and Breitstone. You're listening to Project Independence in You on LIU Public Radio.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence in You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Otto Los and Paula Ewell, and we're diving right back in with Ron Fatoullah, talking about all things Medicaid, long-term care Medicaid, and whatever questions come our way. Otto's got a whole list. So let's jump right back in.
It's
to,
like a
where we're
personal.
Yeah, he's getting his free consultation.
Perfect.
yeah, really. I know you do have a
But
lot
I
of
happen to be
questions here.
probably
We didn't get to number one yet.
a general example.
Yeah, we didn't get to
actually.
number one yet.
Right,
So-
right. Keep going.
Yeah. Well, you just started to say something in the break about, like, if your income is at a certain point, does it make sense? Like you said, the $20 million
Sure.
client
Yeah.
who wanted to apply. What's the
I mean, I could get them on Medicaid, but it's ridiculous. I would never do that in a million years.
yeah. I mean, because they really, it's supposed to be
It's
for
not what the
people.
what
Right.
the program is for.
Yeah, it's supposed to be for people who need
You don't want to
it.
take it. There's a limited resource. You don't want to take the resources away
Right.
from lower
For
and
people who
middle
need
class
it, right.
people that really need it.
Can somebody go to an attorney such as yourself and get a consultation providing all the basic information that they have, like resources, income, whatever, house and value, whatever, have a consultation that would basically come up with a game plan wrapped around, no, you shouldn't apply for Medicaid because it's not realistic. B, you should have a trust, maybe, just for a house, if that's all you might have. Is that something that can be done?
Not only can it be done, I've been doing that for 40 years. Yes.
Right.
We do it all the time. We don't move ahead with anything.
And by the way, I expect that you would pay for a consultation like that.
Yeah.
Yeah.
It's a reduced
Yeah, I
price.
know,
It's-
but I mean,
yeah.
realistically, that would be expected.
Right, but that's the way to go. So we
Right.
spend a couple of hours, at least an hour and a half, typically, hour and a half to 2 hours with a client, going over everything and coming up with a game plan to see if it makes sense or not. For example, we just saw a client who was middle class. Who knows what middle class is anymore? But she had
In theory, they're
she's a millionaire, but
Broke middle class.
she has a
I
home
want that middle class.
that is worth $1 million, and she has about $1 million in other assets, half in retirement account, half in non-retirement. But she has $2 million of an estate, but she is definitely middle class. In today's day and age.
Yeah, it used to be if you were a millionaire, oh, wow.
yeah.
Yeah, exactly. There was a book,
Yeah.
Your Millionaire Next Door, something like that. But Now, you really can't survive well with too much under that.
When I was a kid, the vision was if I could make $100 a week, I'm going to really be rich. And, that's true.
And now you could go to Starbucks.
Yeah. Maybe with two people.
Maybe with two people. So it depends on your assets. Medicaid looks at the assets. They do look at your income. But if your income is very high, it just may not make sense to go on Medicaid. So I just saw this client that has this home and about $1 million in assets, but she has a very good long-term care policy. I couldn't believe it. Wish I had this. Lifetime policy. $650 a day, lifetime policy, $100-day elimination, which is standard, an inflation rider, and she said, "Do you think I should do Medicaid planning?" I said, "No. Let's avoid probate. Let's do all these other good things. Let's make sure you have your power of attorney, healthcare proxy, but you don't need a Medicaid trust."
Well, that's an interesting one you brought up is the need for, where the hell was I going with this? The need.
The need for the Medicaid trust.
The trust part, but she's.
Oh,
I know, the long-term care insurance. Does that count as a resource when calculating Medicaid?
Medicaid is a payer of last resort. So Medicaid will look at your insurance benefits.
Right.
So Medicaid looks at Medicare. Medicaid would look at your long-term care benefits. But you don't have to maximize your other benefits. And this law that came in, it was just so amazing. You don't have to apply to Social Security early, where Medicaid say, "Oh, you apply for Social Security early, you'll have more money, and we could pay less." You don't have to do that anymore. This is brand new law, and this just changed. But yes, they do look at your income. And what I started to say before the break, you can't alienate, you can't assign your income to third parties. ERISA, the law, stated that you can't alienate Social Security or your pension income, because if a creditor came knocking on your door, they could have said, "Well, assign over all of your income to me, and then you're going to be left with nothing." So you can't live. So there's a law that bans that. So you can't alienate that. We can't put that income in a trust. It just sits there. And if we apply for Medicaid for a client, we would have to look at their Social Security and their pension, and that will count.
Yeah, now what would be a rough number in terms of what you can't go over in order to apply for Medicaid?
You could go over, but it won't make sense to apply.
Yeah, right. I'm saying what's the requirement as far as Medicaid is concerned? Is there a number that says if you make more than $75,000 between
it's a waste of time, right?
those two things, you shouldn't bother?
No, there isn't any such requirement. New York State is a spend-down state. They look at your assets and they budget your income. So if you have too much income, it just won't make sense to apply.
Right.
So a client comes into me needing 4 hours a day, but has $150,000 of Social Security and pension income. Well, we're not going to apply for Medicaid.
Right.
It just won't make sense.
Okay. There's a lot of, like you mentioned, another thing, a change now in the ADL part of it.
Oh my gosh!
For home care, for Medicaid.
Oh my gosh.
Yeah, that changed, and that's a very, very big deal. So it used to be, until very recently, as I said, there's some good things and bad things. The fact that you don't have to maximize other benefits is wonderful. This change in ADL policy is poor. It's not a good thing for us, for my clients. It used to be a couple of months ago that in order to apply for Medicaid, you just needed assistance with one activity of daily living. So we call those ADLs,
right,
such as bathing, dressing, feeding, toileting, continence, transferring, like going from bed to commode or to chair, ambulation, etc. You just needed one. Now you need 3.
Oh, 3.
That's a lot.
That's a lot. And if you have dementia, they bring it down to 2 ADLs with supervision, 2 activities of daily living with supervision. But it went from 1 to 3, and that's a big deal. So what's the first ADL to go typically when I speak to my clients? Bathing and dressing. You know, and a client I just spoke to said I can't reach back and zipper, things like that. Bathing could be very dangerous for a lot of people, slipping and falling in the shower or bathtub. So those are 2. Those 2 aren't enough unless you have dementia.
Wow.
Yeah, I've been
And
through
it's-
this, frankly. There's long-term care insurance has some pretty rigid requirements also when
Yeah.
it comes to ADLs.
They do, but typically on the long-term care insurance, it's 2 out of 6
Right.
ADLs, not the crazy. I was going to use the word stupid because so many people can't go on needed
Yeah.
benefits, and it really upsets me. I get
No.
it's so sad. It really is that there's
When did
not
that
enough
change, Ron?
money.
Just
Just a
recently?
few months ago.
Oh, wow.
Yeah, about 6
know
months
that,
ago.
Ugh.
Yeah. So, Otto, can I go back to home care?
Yeah,
If
that's
I
a
could
big
just say something
Yeah.
that's so basic, we spoke about it, but I will bet that 50% of the listeners don't know or didn't understand what I meant. So there is no look back for Medicaid home care. So what does it mean? It means that if someone has, just pick a number, it doesn't matter. Someone has $1 million in the bank and needs to go on Medicaid, they can transfer those assets into a Medicaid trust or even just outright to their children. There could be tax benefits. Speak to a lawyer before you do that. But you could just transfer those assets out of the applicant's name, let's say in the month of June, and be eligible July 1 for Medicaid home care. Yes, you have to meet the ADL requirements and everything else. So my client that I just saw $500,000 in retirement accounts, that's going to be exempt. $500,000 in liquid non-retirement, transfer that into the trust along with her home. That's worth $1 million. She does that today in June of 2026. As of July
she'll
1,
Medicaid.
she is eligible
For Medicaid.
to go on Medicaid. And she can get 24-hour care. It's harder to get, but she can get 24-hour care.
Yeah, I've been through this at one point with my mother. You know, you start out 4 hours or whatever. It takes a long time. And this is going back a few years.
Yes,
Yeah.
yes. Yeah, but I just wanted people to know, because I hear it all the time. Oh, you know, my mother needs, or my wife or husband needs Medicaid now. We can't wait, and we can't go on Medicaid. No, you could have $1 million and go on Medicaid the next month. There is no look back for Medicaid home care and community-based care, which includes Medicaid for assisted living. So we called those units ALP units, ALP beds, assisted living program beds in New York. So I just didn't want anyone listening to this not understanding that no matter what you have, you could go on Medicaid right away. Yes, if you have tons of income or tons of assets, Medicaid may not be appropriate or worth it. But for the average person listening, there is no look back at all for community-based Medicaid.
Now, the home care thing, the ADLs get involved with that, I'm sure, as well.
Absolutely.
Yeah,
Yep.
and I think everybody here knows that the mission of Project Independence is try to help people stay in their own home as long as they can or want to.
Right, exactly.
But we also all know the difficulty of home care. There's not like an army out there waiting to come in to knock on everybody's door. There's a big shortage of home care support.
Home care support and workers. And
workers who actually do the work.
Right.
There's a big shortage. And
absolutely.
Yeah. So that has nothing to do with what we're talking about, but it does in a way, because even though you get there, that doesn't mean it's going to be
magically
golden goose that you got.
No, absolutely. Some of the other ways people were going, with the stricter immigration laws, sometimes it's even harder, now, and the pool is even
it was a way for people to have a job, a valuable job, and an underrated job.
Right.
Like a lot of jobs.
Yeah.
And I know from other people's experiences also, it's not easy, but you have to try.
Right. Right.
Yeah.
Absolutely. Yeah. But it is out there, and you can get it. There's so many Medicaid licensed agencies out there that will do it and are looking for this kind of work.
Yeah, and the other part of it, frankly, which is not what we're talking about, but they do have private pay places that you can go to as well.
Oh my gosh, of course.
If you have the resources in the first place, then you should use them.
Right, absolutely. And people ask, how much does that typically cost? I would say the cost now is around $35, $40, maybe even a little bit more dollars an hour just for custodial care.
Right.
And it used to be, nursing care was $60. Now just custodial, someone to be with you, to change diapers and all of these other things that you may need.
Stuff that happens.
The example is with my own mother, 'cause I just give it to my clients all the time. She broke both hips. She had 2 hip replacements, 2 knee replacements. She was a very stubborn woman.
Sounds like my mother.
I loved her to pieces, but I wanted her to get someone. Yeah. But by the second time she fell, I said, "Mom, I'm getting you someone." And she resisted, but she got somebody. She never fell since she had somebody with her. And I'm just saying this because I know your mission is to keep people at home, and my mission is really to get the word out. And I thank you for the forum because I want people to protect themselves. It's what I really want.
My brain is running here, but the qualifying part, one of the changes that we read that you sent in has to do with the value of your home, that they changed the cap on it, and on Long Island, that could be an issue because everybody's house is overinflated.
Yes.
So maybe give us a little touch on that one.
Absolutely. And this was also new. So many crazy things going on. So right now, as of this very moment, you could have equity in your home and still go on Medicaid of $1,130,000. That happens to be the Medicaid number. It started in 2005 at $750,000. With inflation, now it's $1,130,000. So if there's an individual not married wanting to go onto Medicaid and has a home with no mortgage, with an equity value of under $1,130,000, they won't have too much, quote unquote, money for Medicaid. But if their equity is over $1,130,000, they will have too much money, quote unquote, money to go on Medicaid.
If the house is like $1.5 million
or $1.2 million,
you got a cap. What happens with that money that's over the?
Okay, there's an exception to the law. If there's a spouse, minor, blind, or disabled child living in the home, these rules do not apply. So what's one thing you could do? This is a joke. you could go get married.
Everyone's
But I'm
running
only
out there
kidding,
to the
everyone.
chapel.
I'm only kidding. But seriously, if there's a spouse, blind, minor, or disabled child in the home, these rules do not apply.
Just a spouse, doesn't have to be sick or
Just
anything.
a spouse.
So basically a married couple.
These equity
Is it-
rules don't apply.
Oh, that's interesting.
Right. But it is $1,130,000 currently. After the break, I'll go into the rest.
Oh, look at this. What a professional
He's a
guest here. After the break, we will continue talking with Ron Fatoullah of Meltzer, Lippe, Goldstein, and Breitstone. You're listening to Project Independence in You on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence in You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Otto Los and Paula Yule, and we're diving right back in with Ron Fatoullah, talking all things Medicaid and just preparing for your future. So we picked up, we cut off it during the break, so let's pick up where we left off.
Yeah, no worries. So right now, you can have equity in your home of $1,130,000 and go on Medicaid. Those rules don't apply if there's a spouse, blind, minor, or disabled child living in the home. But there is a brand new law, federal law, that caps the home equity limit at $1 million with zero inflation going forward. That's scheduled to come into effect in 2 years. So it's not here yet, but it's, in 2 years, the $1,130,000 will likely be about $1.2 million. It's actually going lower. So you can't even get a studio apartment in Manhattan. Somebody in Manhattan with no spouse, having a little apartment with no money, can't go on Medicaid? Come on. I think this is, it's an awful, awful law that was tucked in a bill, a federal bill.
Well, single people, a widow, widower, who has a home, and they don't have much else. The biggest asset they might have, most people, frankly, is your house.
Right.
So they're going to be in hot water, basically.
A lot of
Right.
people.
Yeah.
So what because of this $1 million limit that's looming in a couple of years, we're $1,130,000 on Long Island, here in the North Shore of Long Island. What's the average home price? It's crazy. Otto, I agree with you. It's overinflated, but it is. This is the way it is.
Well, supply and demand.
So what could people do? Well, if you're older, don't wait till you have a diagnosis of dementia. Don't wait till you have severe osteoporosis. What you should do is start to plan. And you can protect the home. Most individuals would transfer that home into a Medicaid asset protection trust. That trust is an irrevocable trust. I think it might have been a couple of years ago on the show where I might have mentioned this, but it is the best way to protect the home, especially. And just piggybacking on what I said a little while ago, retirement accounts are not counted. And if you protect the home, then we're just dealing with the liquid assets you had. And Otto, you just gave an example of somebody who's cash poor but has a home.
Right.
And a very good way to handle that, even if they have a retirement account, that's exempt already. Don't worry about it. Just make sure it has to be in payout status. Not a big deal, as we discussed before. And if we put that home into a Medicaid asset protection trust, the home will be protected. There is no look back. The home is protected immediately from Medicaid home care. But sadly, there's a 5-year look back when it comes to nursing home care.
Right.
Not the ALP units, not the assisted living program beds.
Yes, I know.
But For nursing home care, there is a 5-year look back.
Okay.
But it means if someone needs Medicaid home care today and they transfer that home, $1 million home, into a Medicaid asset protection trust today, they will be eligible for Medicaid if their assets are below $33,000. They could have $1 million in retirement accounts, but in payout status, but $33,000 or less, they could go on Medicaid as of the first day of the next month.
Yeah.
So it's a good way to do it.
Yeah. I have a question. Oh,
Sure.
sorry. Go ahead. About the assisted living and
Sure.
Medicaid. So, if somebody goes into assisted living, a private pay status, however long their money lasts, with being Medicaid eligible, can you then apply for Medicaid when you're actually already in?
Well, you
For your
you
home
mean
ca-
if they take you before
Yes,
you apply
yes,
for Medicaid?
yes.
Yes.
Like,
But
you know.
since there's no look back,
Right.
most individuals would qualify immediately, and
Yeah.
But if you go on, definitely.
Okay.
If you're going to be privately paying, because it might be hard to get into a
Right,
place,
right.
you privately pay initially, and when your assets get down to the Medicaid level, for sure they'll take you in. A better way to do it is to protect assets, transfer
right.
assets over the 33,000, but not
Right,
retirement
right,
accounts,
right.
into the trust and go into that
Okay.
Medicaid-funded assisted living, the ALP units
Okay.
right away, such as, can I mention any? Such as Amber
example,
Court.
right?
Yeah.
Example. That's
Yeah.
an example.
No, they're
Amber
wonderful.
Court in
Yeah.
Westbury.
Yeah.
Which
Yeah.
is a great
no, they're
place.
Wonderful.
Yeah,
Yeah.
it is a great
Yeah.
place, and Medicaid funded.
Right.
Yeah.
You know, the more we get into this, the more I look at it and I think to myself, a major factor here in planning is it realistic for you to ever really be qualified for Medicaid? And if not, then the next question in your mind is, should I have a trust for a house, for example, which we've talked about much and often. Why? Because of probate. Last week we had somebody on about deed thefts.
Right. It's not funny.
Yeah,
No,
it was.
not funny
We were
at all.
shocked. We were shocked.
I
how
just-
easy it was.
Yeah.
I was
Oh,
just
yeah.
chuckled because people are so crazy. They're going after everything.
So I guess the point I'm getting at here is, okay, we've got trusts that are geared toward Medicaid, but we also have a need for trusts that aren't geared to Medicaid, which then becomes a little more complicated. And I'll tell you what I hear, and include myself. Oh, I don't need it because the CDs and the IRAs and this and that, we have beneficiaries assigned for all of them. So the only thing remaining is the house. So in a situation like that, can you get a trust just for a house?
Sure. I did one yesterday, and I'm going to be doing another one today, actually. But yes, absolutely. Yesterday, the individual, it was a second marriage. They certainly needed a trust. When the home is going to be sold, 50% will go to his children, 50% will go to her children. And that's the way they wanted it. You know, if you do a will, let's say you do wills instead of a trust. One spouse dies, the other spouse could simply redo the will. I'm not saying he or she will, but it could be done.
Right.
When you have even a revocable trust and one creator of that trust, the grantor, one creator dies, the trust becomes irrevocable. So the couple is protected that the assets will go just the way they
way they
want them
want
to
it,
go.
Right. Okay. So you could get, like we talked a lot between us, protecting yourself for probate. I've just, one of my in-laws, son-in-laws, had to go through it, and his father did have a trust, so it was easy for them to go switch the house and do what they had to do. And I hear people, it can be, for probate, can be anywhere from 3 to 9 months or whatever, depending on whatever complications you might have.
Well, I'll correct that.
Yeah.
It can't be less than 7 months after the
Right, 'cause you gotta keep it
executor.
in, right.
Yeah, you need to have the estate going, because otherwise the executor is going to be liable. So it's at least about a year.
Right.
Yeah, I mean, that's conservative.
Okay.
So if you could avoid it, why not? And you don't need a Medicaid Asset Protection Trust to do it. We do all different kinds of trusts every day of the week, and you could avoid probate, but get other benefits as well from the trust.
Yeah, this is where the consultation part comes into play.
Yeah, no, exactly. But if there's a disabled child, you want assets to go into special needs trust. You want to give assets to grandchildren. You likely don't want them to get a lot of money at age 18.
Right.
You know, you set up a trust. You have a daughter or a son that's a spendthrift, can't handle money. We had 2 in the last month. You set up a trust so the money lasts.
Yeah,
you
as
know.
I say, it's complicated.
For Medicaid and for estate taxes for wealthier individuals. We do SLATs all the time,
Right.
spousal lifetime access trusts, and, you know, we could eliminate estate taxes most of the time.
Wow.
But that's a different type of trust.
Yeah.
Yeah, well, until last week when we had this deed theft thing on,
Shook us up pretty good.
we did not realize how easy it is to steal somebody's house.
Oh, it's crazy.
Yeah.
Yeah.
You know, you can get alerts set up with Nassau County if you live in Nassau County, but that's after the fact. That's after.
Yeah, right. It's too late.
They've already been fiddling around with your
Right,
house.
right.
Right.
You know, so to be warned, like I'm going through this identity theft, to be warned before it happens is not possible in any of these situations. So you got to protect yourself if it does happen. You know, how do you protect yourself?
You know, I just had my checkbooks, you know, a check duplicated by I don't know whom, writing $4,000 checks that were trying to be cashed throughout the country.
Oh, wow.
Yeah. That's why I chuckled a little, not because I thought it was funny, it's just
It
it's
happens.
so prevalent.
The
It is.
scams
so
are
prevalent.
all over the
Right,
place.
in all different forms.
Well, I
My
could-
bank, Capital One, caught it, thank God, and none of these checks, but it was incredible. So
Think
many
about
checks
it, yeah.
out there
Yeah.
trying to scam me.
We could have a show just on this because I'm just this week going through it.
I'm so sorry.
Checking
It's
account
terrible.
gone, credit card gone. I really basically am cashless. I can't pay anybody. You know,
I'll give you some money.
only the cash I have in my
I
pocket.
don't got your back.
You know,
You
everything
can
is
use my
kaput.
kaput.
Christina, you don't do GoFundMes, do you? For Otto? No. Okay. No. I'm teasing, Otto. You'll be fine. You'll be fine.
Yeah.
Oh yeah, I
Yeah,
mean
you're
I'm
just doing
I'm
all the
chopping
work.
away
But
at
it's just
it.
such a,
Yeah.
it just shows you what it
awful.
matters. Yeah.
You know, actually, it's very, very, very scary. You feel sort of, I don't know what the word is, naked out
It's
there.
like
You-
violated. You're
Abused.
It's
violated.
extreme.
Someone's in your
extreme-
finances.
You
Well,
are
and-
totally
That's private.
violated.
Yeah.
You know,
Right.
because of what we are doing here and the number of
And-
people we talk to,
Yeah.
I'm pretty well guarded.
Yeah,
You know,
I was
got
just
alerts
thinking the
all
same
over
thing.
place.
Right.
And the guy in the bank told me, he says, you did everything you
Yeah.
could possibly do
Yes.
for it not to happen.
And it still,
And it still
could
happened.
And it still
happen.
happened.
Yeah.
And they do target seniors.
Yes.
Yeah.
Yes. And
Which is just so awful. They prey on and you're not one of, you know,
right,
they try to prey on people that can't manage
Right.
things.
I
and
have
it's
friends
so
of mine
awful.
that are, you know, they would be really in big trouble. They really would.
How did you find out it happened?
Luckily,
did you get an alert
the bank
or something?
sent me a notice that they blocked it, and I thought it was a scam credit
okay.
email.
Right.
All right, so I sent it to their spoof department,
Right.
and then I'm over in Young's Farm over in.
I love that place.
Yeah, me
Yeah.
too.
Yeah.
So we're there, and I buy, you know, whatever I buy, and it says your card's
Denied?
declined.
Oh my God.
Oh, okay.
Oh my God.
So then
That
I get a
horrible
hold of
feeling.
Citibank right away, and yeah, it's blocked. But then I find out when I go into the branch, thank God there was a really good man there. And I go in and he says, you know, I said, when I go online, my checking account's not there, CDs are not there, savings account is not there. The only thing there is a brokerage account.
Oh my God, that's devastating.
Yeah.
So I said, where did those accounts go?
Where did they
You know?
go?
Yeah,
Oh,
well, they
oh,
weren't
God.
online. I
Right,
couldn't.
Oh my
right.
That's
good Lord.
devastating.
I can't. It's making
Yeah.
me like
so
anxious. even
he
thinking
looks
about it.
into it. I spent an hour and a half with him, and if I didn't go to the branch, I can't imagine how it ever would have been resolved. He finds out that somebody has somehow managed to set up another email, another cell phone, another address on my account. and okay, they suspect this, all right, and they blocked the account. Luckily, no money
Yes.
went out at all.
Okay, good.
All right, but it could have.
And I had something very similar too, but Chase caught it right away.
Yeah, Citibank in
where
this
I got a
case.
call saying they were from Chase and they wanted to know if they had access to everything. They were looking at my credit card saying, I said, how do I know you're Chase? Oh, I'm looking at your credit card. You had this charge and that charge.
Right.
Here
You
are
don't
my
even know, do I
credentials.
answer? Right,
Right.
yeah.
And it was total scam.
Yeah.
Total
Oh, my
scam. And they started to ask me for my Social Security number.
Yeah.
And then, I
That's
clicked.
right.
And I went right to, I didn't even call. I went right to my branch. And they said it was a scam, a fraud,
Yeah.
But how easy would it have been for
Right.
you to get caught in that?
course.
if I was frail mentally.
Yeah, you would have.
And not
even
even,
not.
Even
and,
loose-
and that's what I think is like important to know, because even not like, it's so easy to be, we're all obviously all aware of scams and savvy and know how to prepare ourselves, but it's so easy for that to happen to you. I mean, like, if someone's calling you reviewing your thing, it seems legit. Like,
Yeah.
who wouldn't think? And I think that that's such an important message.
Well, my
is to
first
just be
reaction when I got the
hyper-aware.
email from Citibank saying it was blocked was, oh, this is a scam.
Right.
All right. And I sent them the email telling them I think this is a scam. I sent it to my family. I told them to beware.
Right.
Well, 2 days later, I found out it wasn't a scam, that my account was hit.
Right.
Well, I think that's just a
But
little
that has
reminder.
absolutely nothing to do
No,
with
but it's a reminder
Right,
about
right.
how important it is to
No, but what it
plan
does
and
have to do
prepare
with
and
is
keep
things
track.
like guarding and
Yep,
shielding,
protecting your
like
assets.
a trust
Yes.
perhaps for your house.
Exactly.
Yeah. And it typically is
And
a
I'm no-
great way to go.
It took a long time for me to get to this point, Ron, where
Yeah.
I spoke favorably about a trust. All right.
He said,
Sometimes we could wear Otto down.
right.
Took you 7 visits.
Not
to
often.
Well, we only have a couple of minutes left, Ron. So, is there anything else you want to touch upon? Any new laws or acts or whatever that you want to bring up?
Yeah, I do actually. Just because it's something that's going to be effective August 1st, we're, I think, the 13th or 14th state in the nation that will permit medical aid in dying. So if you have an incurable disease where your life expectancy is 6 months or less, and you are lucid enough to do this, and you express your intent, and there are doctors, etc., and there are waiting periods, but you can end your own life. There are a lot of safeguards, but you can end your own life, I dare to say, on your own terms. And I know there are so many people that are against this and so many people for it. So Governor Hochul tried as best as she could to provide many, many guardrails, around this. And one of them is saying, if a facility themselves or a physician or a provider doesn't feel comfortable with this, they do not have to participate. They don't have to participate. And one very important message I want to get out there, that if an individual does this, on the death certificate, this would not be deemed suicide.
That's it.
The cause of death will be the underlying disease.
That led
Right.
them.
So if there's life insurance or other benefits,
Right.
sometimes you mentioned pension benefits, spousal pension
Yeah,
benefits,
100%.
that would not be affected by this medical aid in dying. God forbid if anyone is in that position.
Well, I use one that I've just gone through not too long ago. A woman who was in a nursing home, couldn't get out of the bed, couldn't talk, and couldn't use her left arm. And this is a woman who was very vibrant, went to shows, did everything, all right? And this went on for 3 years. and I was close with her daughters, and we all said if there was just a way. Now, using that as an example, she couldn't really talk. So when you say you have to be lucid enough,
Well, she has to
Well, that's
take
your
her own
cognition.
medication and understand if she can't write, she could still, if she she can talk, and that's good enough for the Medical Aid in Dying Act. But if she...
Well, I'm sorry. We're going to have you back because we are out of time. If leave it to Otto to ask a question at the end. We would like to thank our guest today, Ron Fatoullah, for such beneficial info. And Ron, we will certainly have to have you back. We'd like to thank everyone who's joined us. You're listening to Project Independence and You on LIU Public Radio.